Earlier this year, King Charles underwent a procedure for an enlarged prostate.
That sparked interest in the extremely common condition among older men. In our Health Watch, Derek James has more on a less invasive treatment more men are choosing to treat their symptoms.
Sure, there's a little bit of nerves, but it's a relatively simple procedure.
Ro Weinkoff is about to undergo treatment for benign prostatic hyperplasia, or BPH, a non-cancerous enlarged prostate. The growth of the gland puts pressure on the urethra, weakening the bladder.
For about 10 years, I've had some issues with urinating.
By the age of 50, half of all men will have the condition, and the percentage increases with age. There are multiple treatment options for BPH, ranging from medications to surgery. Dr. Jafar Golzarian and a team at the University of Minnesota Medical Center were the first in the U.S. to complete a less invasive option called prostatic artery embolization in 2012.
Our technique is the only one that actually goes through arteries or through the wrist or through the groin.
PAE is performed completely inside the body. Dr. Golzarian and his team are using imaging to send very tiny catheters through the blood vessels to the treatment area. Inside, particles are injected that plug up the artery, blocking the blood flow.
And by making the prostate softer, it reduces the pressure on the urethra, and so a patient can urinate better.
I was getting up 5, 6, 7 times a night, having to go to the bathroom.
Norman Monk had the procedure in late March after suffering for over a decade.
In and out in 5 hours, light sedation, less side effects, less expensive, and in some ways more effective. And there's no risk of sexual dysfunction.
Although PAE is FDA approved, Monk struggled to get the treatment covered by insurance.
The idiocy of that and the gatekeepers, if you go through Medicare, you can get it approved. If you have an Advantage plan, then you're working with gatekeepers.
Monk and Dr. Golzarian are on a mission to make sure more men know that there are less invasive ways to treat their BPH symptoms.
Really helping a lot of patients.
This will save lives as well, but certainly it'll make lives better for people.
In Golden Valley, Derek James, WCCO News.
Not all patients are suitable candidates for PAE. Embolization is also being used to treat tumors, internal bleeding, uterine fibroids, and even osteoarthritis.